Hi, I'm Sam Gordon-James, and thank you for taking an interest in our paper titled Integrating Technology into Self-Management Ecosystems, Young Adults with Type 1 Diabetes in the UK using smartwatches. Self-managing a chronic condition requires constant thought and energy, placing a large burden on those who perform it. Coping with this burden often involves utilizing technology and the people around you, and this group forms the self-management ecosystem. Increasingly, new technology is developed to assist in self-management, but these new devices are not used in a vacuum. Individuals must learn to use these different elements of the self-management ecosystem as a collective. The components can sometimes interact with each other and contribute to the same role or function, further adding to the complexity. To explore this dynamic, we look at the case study of type 1 diabetes. Now, those with type 1 diabetes are unable to regulate their blood glucose levels naturally, so must monitor them and inject insulin to manage it themselves. The condition has benefited from many recent advances in management technology, resulting in many people having multiple devices in their self-management ecosystem. Closed-loop systems, the state-of-the-art of diabetes technology, link together an insulin pump and a continuous glucose monitor using an algorithm to automate part of the management process. The mix of these different devices and the links between them are what makes type 1 diabetes such a valuable case study. We focus further on the young adult population, as the unpredictable nature of this period of life provides a more robust test for technology, and this group has a higher engagement with new technology, increasing the relevance of this work to them. To explore the process of integrating technology into self-management ecosystems, we recruited 24 young adults from the UK who live with type 1 diabetes and used a continuous glucose monitor and an insulin pump. We then gave each participant a smartwatch from a range of choices, unless they opted to continue using a pre-owned device. 10 of the participants had used a smartwatch prior to the study. Then over the next 6 months, participants used the smartwatch alongside their typical type 1 diabetes management. And each month they were involved in a round of interviews or focus groups to discuss their experiences using the smartwatch and a range of other topics related to wider type 1 diabetes management. This mix was chosen to gather in-depth individual insights through the interviews, and then also to foster discussions highlighting the smartwatch capabilities during the focus groups. The sessions were transcribed and then thematically analysed altogether. The findings from the analysis are presented in 4 themes, each of which reflects a different element of using a smartwatch in type 1 diabetes management, how it was experienced, and the potential role it could play as a worn device, a display, an interface, and a data source. From these findings, we discuss how a smartwatch could be utilised in type 1 diabetes management, and more broadly, how technology can be designed to effectively integrate into a self-management ecosystem. There was wide variation in the aesthetic preferences across the participants, including in colour, shape, and size of the smartwatch. Customizable elements were employed to extend the occasions in which participants were willing to wear the watch, for example, to attend a more formal event. Additionally, there were preconceived ideas about different smartwatch brands and how well they performed at different functions. Some participants felt loyalty to particular brands, and overall, this resulted in strong opinions about the smartwatch they wanted to use. There was also variation in the wearing patterns participants fell into, with the device-heavy nature of type 1 diabetes factoring into the decision for some. Many of the participants were able to set up the smartwatch to display blood glucose readings, and this feature was viewed with very high positivity. The smartwatch improved access to this information while providing discretion, and several scenarios were highlighted where this feature was useful. Smartwatches can also be used to display a range of other information, and there was variation in how and what participants wanted to see. For some, there was a desire for additional type 1 diabetes information to be displayed through the smartwatch. However, at times the quantity of information overloaded some participants, or others became obsessed with it, leading to periods where they avoided the information altogether. All the smartwatches used in the study had touchscreens and a range of features. Participants had different preferences on which of these features they used and how they interacted with the device, but throughout the study, they discussed linking the smartwatch to type 1 diabetes technology and extending the interactions that could be performed through it. The most notable example among these were the participants who expressed the desire to control their insulin pump through the smartwatch. As with the display of blood glucose readings, the benefits of access and discretion were stated as reasoning for wanting this interfacing. From the data presented by the smartwatch, participants were able to gain more understanding of the activity they were performing. This led to participants theorizing about a closed-loop system that utilized physiological data from the smartwatch to factor physical activity into its decision-making. Beyond physical activity, other factors and scenarios were expressed that such a system may be able to assist with, including travel, illness, and menstrual cycle phases. The benefits of this link often focused on the reduced self-management burden that it might bring. However, while benefits could be highlighted, participants also raised limitations that would need to be considered around accuracy, trust, and privacy of the data and the smartwatch. This work highlights that smartwatches can be utilized in type 1 diabetes self-management by 1. Discreetly outputting information to users in displays and alerts, 2. Providing an accessible interface for users to input information through, and 3. Interacting with the self-management ecosystem, potentially providing physiological data that can be used to automate parts of the self-management. These findings can be extrapolated to the self-management of other chronic conditions, ensuring it is accomplished in a way that reduces the burden of self-management rather than adding to it. To facilitate this integration, we highlight key areas of consideration when designing new devices that become part of a self-management ecosystem. 1. The use of customizable features to cater to the wide range of user needs and preferences. 2. Flexibility and adaptability to fit with the ever-changing need of chronic condition management and of life more generally. And 3. Automation, by balancing trust and control in new data streams, which added self-management ecosystems to reduce burden in some of the more mundane elements of chronic condition management. Thank you very much for listening to this. If you have any questions or points, please do get in contact with me. I'm really keen to discuss these ideas further and would value your perspectives on this work and the wider research area.